Indwelling urinary insertion, female. Perform hand hygiene. Introduce self. Identify patient with two identifiers. Provide privacy. Explain the procedure. Gather equipment. And assess the patient's history of allergies.
Knock, knock, knock. Good morning, Mrs. Nightingale. My name is Kate. I'm going to be your nurse today. Can you verify your name and date of birth for me, please? Florence Nightingale, 10/17/1958. Great. And do you have any allergies? You're allergic to penicillin? Okay. We won't be working with any penicillin today. Today I'm going to be inserting an indwelling catheter to help with that urinary retention you're experiencing. I have all of my equipment gathered for the procedure. I'm going to go ahead and close the door to give us some privacy. Are you ready to get started? Okay, great.
Position the patient's bedside table at appropriate working height. Ensure proper body mechanics. Verify orders and apply clean gloves.
All right, I've verified I've got physician orders for this procedure. I'm going to put my clean gloves on.
Place waterproof pad under patient and place the patient in the dorsal recumbent position.
All right, Miss Nightingale, I'm just going to move this up and move your legs out.
Ensure perinatal care prior to insertion.
I'm just going to use some warm washcloths to get you cleaned up and make sure you're all ready for this procedure. All done with that.
Perform hand hygiene. Place inner package between patient's legs and open the package, maintaining sterility. Don sterile gloves. Apply sterile drape under patient. Apply fenestrated drape to patient. Organize and open supplies in the sterile field systematically. Coil the catheter and lubricate 1 to 2 inches of the tip of the catheter and attach the syringe to the catheter. Do not test or inflate the balloon prior to insertion. Place the tray onto the sterile drape closer to the patient. Cleanse the urethral meatus, clean to dirty, and prevent closure of the labia during cleansing. This is done by gently separating the labia with fingers of non-dominant hand to expose the urinary meatus. Maintain this position for the remainder of the procedure. Cleanse from clitoris to anus using new cotton ball swab stick each time. Cleanse as follows: 1 far, 2 near, 3 directly over center of urethral meatus.
All right, Ms. Nightingale, take a big deep breath for me. I'm going to go ahead and insert.
Insert urinary catheter into meatus without contaminating catheter using dominant hand. Advance catheter until urine returns.
I see urinary retention, or I see urinary flashback.
Then advance the catheter 1 to 2 more inches.
Okay.
Release the labia, noting the catheter is in place, but maintain position of non-dominant hand. Inflate the balloon with dominant hand and remove syringe. Gently withdraw the catheter until resistance is felt. Anchor the catheter to the thigh and hang the drainage bag on the bed off the floor. This should be to a non-movable bed part below the level of the bladder.
All right, Mrs. Nightingale, I have that indwelling catheter inserted. I'm going to go ahead and put this thigh anchor on for you. Okay.
Perform hand hygiene. Label indwelling urinary catheter bag with date, time, and initials.
I'm going to label this and Mrs. Nightingale, we are all finished. I'm going to go ahead and give you your call bell light, and feel free to call me if you need anything. Otherwise, I'll be back to check on you in about 15 minutes, okay? All right.